your girl Southern Mom, and I am back with a new video. Yes, and as you can tell by my title, this is about my high risk pregnancy. Now, I did not reveal that I was a high risk pregnant woman in my surprise video because I wanted to be fun and lighthearted. But now that you know, I do want to get into the nitty gritty of a high risk pregnancy. Now, there are two things that categorizes me in the high risk department, and I'll talk to you about the first one that I kind of expected, and this was high blood pressure. I am 29 years old, and it's really early for me to be diagnosed with high blood pressure, but last year, February 14th, Valentine's Day, I had the worst scare. My heart was beating so bad, so fast. It felt like it was going to beat out of my chest. I went to the hospital. They kept me overnight. They ran tests. They sent me home with like something attached to me to keep track of my heart rate. But they never declared that I had high blood pressure. So I never got any medicine for it. And now I'm pregnant with baby number 2. And my high risk doctor did say that when they looked at my uterus, they can tell that I have some high blood pressure problems. He did not recommend me getting on a high blood pressure medicine, but he did recommend that I take a low dose Bayer aspirin. It's the regular kind you can get at any store. And so he told me to take these every day, one a day until the end of my pregnancy. Now, I was concerned because you're not supposed to take any medication other than Tylenol, no over-the-counter stuff. But he okayed it. I have an aunt and a cousin who's a doctor. They're both doctors, and they say it's fine. I go to them for sound advice when I think the doctors are acting crazy. But yeah, so I'm taking the low-dose aspirin, and that kind of scares me because it's not far-fetched for me to have high blood pressure. So I'm just taking it day by day and seeing what they have to say on my next visit, which will be December 3rd. Now, I did say high-risk doctor. I go to 2 doctors. I go to my regular OBGYN, and I go to a high-risk doctor. Now, my OBGYN signed me up for an high-risk doctor after I pretermed labor with Ruby Lee. I went into early labor with Ruby Lee. She was born 34 weeks early. Or at 34 weeks, sorry. She was born 34 weeks, at 34 weeks, and she was kept in the NICU for 3 weeks. So they signed me up so that they can try to prevent this baby from being a preterm baby. Okay, so I went to the doctor, and so the high-risk doctor, they don't really take blood or anything. They really just keep track of your blood pressure and give ultrasound. So I go to 2 doctors a month, which is a lot in my opinion. And I'm glad I quit my job because it was no way I would be able to go to 2 appointments every month. That's kind of crazy. And this month I had to go to 3. But so I'm supposed to go to 2 doctors a month. And with the high risk doctor, they do an ultrasound on my belly every time I go. And that's when he saw the high blood pressure. And so after the high blood pressure is early term labor. Now, this is where it gets complicated, and me and my doctor are not in agreement, and I am not on board with what he is requesting. He has suggested that I begin the Makena, I hope I'm saying it right, Makena Progesterone Injections. I wrote it down on this side. It's the Makena Progesterone Injections, okay? And so those shots are supposed to help women who have a history of preterm labor keep their children in the womb as long as they can. Now, that sounds like a good idea, right? Keeping the baby in the womb to as close to 40 weeks as the baby can stay. That sounds awesome. I didn't debate it. And here are they give you 3 options for this shot. The first one is a shot in the fatty part of your arm, a shot in your thigh or buttocks, and a vaginal pill that you have to insert. Any of these 3 methods has to be done 3 times a week. Okay, so I opted for the arm injection, and I had no questions about it. But then I started thinking, this shot is going to prevent my baby from coming early. I need to do more research. And when I started researching, I started uncovering so many things that I was not okay with. I wrote a list down on the side, and I'm going to quickly go through them so that I can let you know why I made this decision. Alright, so now let me tell you, this was not an easy decision to make, but I have decided not to get the Makena progesterone shots. Alright, so after my research, I learned that the side effects are pain in the injection site, which would be normal. I did do a lot of YouTube searching, and I found a really good video. One girl was saying how in the video they show a shot, the girl getting a shot, and it burns so bad. When her husband's done giving it to her, she like pushes him off and goes to the couch or something to relax. But it's like, is it that serious? I mean, you're being pregnant. If you've been pregnant before, you get stuck with a needle all the time. But this seems pretty extreme. So that's the first pain, the pain in the injection site. And then it is administered in an oil. It's administered in an oil. So it's not like some other medication that you get in a shot. It's an oil. I'm not sure what all that oil includes, but that's what it is. Let me see. So setting up the prescription and procedure was strange to me. First CVS Pharmacy called me. I guess that's where it will be coming from. And so they called me to ask me how did I want the medication delivered. It will be coming to my home. And then they sent me over to Makena, who makes the medication, and it was like a 20-minute conversation on the phone setting up the arrangements to have my shots administered. And they gave me 3 options. 1, I can let someone who's close to me administer the shot. 2, I can let a nurse or someone who's well informed on the shot come to my home and give me a shot. Or 3, I can go to the doctor every week and let them give me a shot. Of course, I was going to go with my husband giving me the shot, but well, since we're not doing that anymore, that's out of the picture. So I did more research with Makena specifically. I went to their website, and on their website, they show a case study that they did on their own medication, and they found out some things that were very I wasn't pleased with what I saw, and so I wrote that on the side too. So it says, after the call, I was sent over to an automated message. Oh, that's correct. That went over the side effects of the shot, which includes miscarrying, stillbirth, depression, and blood clots. These are all the effects that we are trying to prevent. Now, I know all medications have side effects, but in this case, these effects are serious. Stillbirth, miscarrying. Are you kidding me? Ruby Lee was born 34 weeks early. I know exactly why she was born. I didn't have a hard pregnancy like on my body. I never bled. I never cramped. I ate healthy. That wasn't the problem. I was under stress in my marriage, which is something that some marriages go through at times. Unfortunately, it happened to be my first pregnancy, and Ruby got the backfire of it. And so, and I also did a lot of walking at the end of that pregnancy. I mean, I went to Chicago I wasn't supposed to do that now that I know how pregnancy works. But yes, I went to Chicago. I walked a ton because that's what Chicagoans do. We don't really drive. We get on the bus, we get on the train. And I was so accustomed to doing so that I didn't know how much stress it would put on my 32-week body, pregnant body. And so I was there walking, and then I got home and I started painting, getting ready for Ruby to get here. So my body was under stress. I don't think that something crazy went on. I don't think that anything that is a serious matter occurred while I was pregnant with Ruby Lee. And I plan on making this pregnancy as smooth and safe and loving and stress-free as possible. And my husband and I have been doing a great job of that. And I have to say that after we had that tumultuous time in our lives have been perfect almost. I don't want to jinx it, but I'm not under stress, and I don't think that will occur again. If I were someone or a woman who had a baby 20 weeks early because of true health issues, then I would consider it. But since Ruby really was 34 weeks, she would have been 35 had I made it to that Tuesday. So since she was 34 weeks, born healthy, they kept her for 3 weeks because my placenta did rupture, but she wasn't sickly. I am not so on trying to take this injection and risk miscarrying or stillbirth or blood clots during this pregnancy. And so after the call and after looking on the website, I also found out that 13% of the women given the shot ended up miscarrying or having a stillbirth, and 16% of people who were placebo, meaning not taking the shot, had a stillbirth or miscarriage. Now, the odds having a stillbirth or miscarriage while taking the shot is a little bit lower than the odds of having a stillbirth or a miscarriage while not taking the shot. That's a good thing, but it's not a tremendous amount of difference. You get what I'm saying? Although the Makena helped some women carry longer, it was just like a 2% amount that did not. The other percent, it just wasn't enough for me. I feel like if this shot is supposed to be known for keeping a baby in for so long, then it should do its job the first time and not ever have to risk it. And that's the thing. I was thinking, if a woman's going to make, I am a Christian, okay, and I do believe that God, whatever happens is in God's plan. And I don't think that this shot has 100% capability of preventing something that was going to happen anyway. Do you understand me? And so, in my belief, although I would like to carry my baby full term, and although this shot may work for other women, I am going to stay prayed up and stay praying that I continue to have a safe and healthy pregnancy and move along with the regular way to do this. Now, once I told my doctor this, he was not thrilled, but I do believe that everything will work itself out. So that's me and my high risk information that I want to share with you all. Please don't bash me in the comments. I'm just telling you what I am experiencing and the decisions I am making for my family and I. So that's it. Thanks for coming. Thanks for watching, and I will see you next time. Bye.